We often talk about cancer as a physical invader. We talk about cells, tumors, stages, and treatments. But we rarely talk about the silent battlefield, the mind. Today, we are looking at ovarian cancer. We will explore the medical reality of this disease, but more importantly, the profound mental conflicts it forces a woman to navigate. Ovarian cancer begins in the ovaries or the related tissues of the fallopian tubes and peritoneum. It is notoriously called the silent killer. Why? Because its early symptoms are often the exact same everyday discomforts women are taught to ignore or minimize. Only about 20% of ovarian cancers are found at an early stage. For many, by the time the whispers of the body are finally heard, the cancer has spread. Because there is no standard, reliable screening test for ovarian cancer, like a mammogram for breast cancer or a pap smear for cervical cancer. When a doctor says the words, "You have ovarian cancer," a deep internal conflict begins immediately. It is the conflict of betrayal. A woman's body, often tied to her sense of vitality, femininity, or motherhood, suddenly feels like an unsafe place. The very organs that represent life are now threatening it. This triggers a series of heavy psychological conflicts. Treatments like surgery and chemotherapy can strip away the external markers of identity. Hair loss, weight changes, and surgical menopause force a woman to ask, "Who am I if I no longer look or feel like myself?" For younger women, the sudden loss of fertility is a grieving process all its own. Society expects cancer patients to be warriors, stay positive. But this creates a terrible mental conflict. How do you force a smile when you are terrified? Patients often suppress their completely valid grief, anger, and anxiety just to make the people around them feel more comfortable. Even in remission, the mind struggles. Every stomach ache, every twinge of back pain brings a paralyzing question. Is it back? The mind is locked in a state of hypervigilance, unable to trust the body that once harbored a silent disease. So how does one survive the mental conflict of ovarian cancer? You don't do it by pretending the fear isn't there. You do it through radical acceptance and support. It requires acknowledging that two things can be true at once. You can be incredibly grateful for your treatment and completely devastated by the toll it took on you. Healing the mind requires specialized oncology therapy, finding a community of fellow survivors who actually understand the specific grief of gynecologic cancer. And for many, reclaiming control by listening to their bodies and advocating for their health. If you are navigating ovarian cancer, know this: your fear is valid. You do not have to be a fearless warrior every single day. Healing is not just about clearing the cancer from the cells. It is about making peace with the mind. And that is a journey you never have to walk alone. Thank you, and stay connected.